celebrations, Father's Day gatherings, the Indy Ultimate, and more, all reminded us of what we've been missing out on. Coming up, Dr. Caine will share the latest as we evaluate our ability to lift restrictions in the midst of our latest vaccination push. But as incredible as it has been to get back to public events, the best part of the vaccination effort so far is the reduction in serious illness and mortality that we have seen since vaccinations were initially made available. So today, ahead of Dr. Caine's update, I want to congratulate everyone who has helped our city make it to this stage of recovery. By getting your shot, you have helped make this a summer of reunion for the city of Indianapolis. Today, after half a year of observation and data, there are things that we know about the personal health benefits enjoyed by those who choose to be vaccinated. First and foremost, vaccinated residents now make up less than 1% of positive tests for COVID in the state of Indiana. Let me repeat that. People who are vaccinated now make up less than 1% of positive COVID tests throughout the state of Indiana. However, those few who do become infected are still 100 times less likely to require hospitalization compared to unvaccinated individuals. And thankfully, the data shows that currently available vaccines are still resistant to the new and significantly more contagious Delta COVID variant. That's important, as CDC officials note that this variant, the Delta variant, is prevalent among those under the age of 50 and will soon become, it is predicted, the dominant strain of coronavirus here in America. Now, the flip side to all of this is that residents who still choose to forego vaccination are missing out on these benefits I've just outlined, and they are imposing an unnecessary burden on themselves. They're posing an unnecessary burden on our healthcare system. Yes, our larger society needs a level of immunity to function normally. However, as we continue to move closer to that level, those who remain unvaccinated will still suffer COVID's worst effects if they become infected, all the while potentially spreading it to others. So those who remain unvaccinated suffer the worst of COVID's effects personally, and then unknowingly, perhaps unwittingly, are spreading the virus to others. So if you are still hesitant, I urge you to reach out to those who have received the shot. Ask about their experience. After 7 months, over 150 million Americans who have received the vaccine, provide 150 million firsthand accounts. And so asking someone is readily available, your neighbors, your friends, family members. As always, I'll close by adding my thanks to our health officials, to our healthcare workers for the extraordinary turn of events we've experienced as the result of the vaccine. And with that, I'm glad to welcome Dr. Caine to take the floor. Dr. Caine.
Thank you, Mayor, and good morning, everyone. Today we have positive signs to share that our mitigation strategies are working. Our daily new cases are down, positivity rate is down, our deaths are down, and every day more residents make the decision to roll up their sleeves and get the vaccine. Now, those Marion County residents who make the decision to get vaccinated at a health department location between now and July the 2nd will not only receive the life-saving protection the vaccine offers, but will also be eligible to win a number of exciting prizes, whether it's from the Children's Museum's tickets, to a Zoom membership, to park passes, to sign jerseys and tickets to some of our favorite local teams, the Colts, the Pacers, and the Indians. And visit marionhealth.org/vaccinate-Indy for more information. Now, we're continuing to make it easier for our residents to access the vaccine with our pop-up clinics taking place across the county. The schedule of these clinics can be found at our marionhealth.org/vaccinate-Indy. With 86 recipients of our COVID Community Recovery Grant Program now working with us to combat vaccine hesitancy, share education, provide better access to our vaccine clinics, I am confident the vaccines will continue to reach our residents over the coming days, weeks, and months. While all of these positive things are happening in our community, the Delta variant of COVID-19 has reached Indiana. And this strain is estimated to be 40% more contagious than the original strain of the virus and is impacting our 12 to 20-year-olds significantly in the United Kingdom. So I know some of the parents in our city are still hesitant about giving their children the vaccine. And I know that to many it feels like a risk. But I can tell you with certainty, it is far more of a risk to leave your child unprotected in the face of this deadly virus than to give them a vaccine that has been rigorously tested and studied and has now been safely administered to millions of people. So speaking of hesitancy, I'd like to take a moment to talk directly to some of the concerns I've heard from our community related to the vaccine. The emergency use authorization process through which the FDA approved the COVID-19 vaccines requires clinical trials involving tens of thousands of people, rigorous evaluations of these trials, and resulting evidence that the vaccine is safe and effective. And all available COVID-19 vaccines are undergoing the most intensive vaccine safety monitoring across a process that we've ever had in the United States history. So no serious long-term health problems or fertility issues have been linked to COVID-19 vaccines. Now, the COVID-19 vaccines are free to everyone, and no Social Security is required to receive a vaccine. Free transportation is available to a vaccine appointment through IU Health. And all you have to do is call 1-888-IU Health. Let me repeat that. Call 1-888-IU Health. and choosing option 9. Free child care is also available to help any parents and caregivers get vaccinated and recuperate from any short-term side effects. And more information can be found at vaccines.gov/incentives.html. Now, before I detail our current data, I will turn to the topic I know is pressing on all of our minds. When are we reopening? Several weeks ago, we set a goal to reach 50% of our population fully vaccinated on Independence Day. While this number was a fixed goal, reaching the level of protection that keeps our community safe is not. And as I have alluded to before, herd immunity is not a switch, it is a gradient. And ultimately, the decision to reopen is not about whether we surpass one particular metric, but whether the level of protection from the virus in our community can prevent significant spread and outbreaks. Now, to make this determination, we've been looking to places, for example, like Israel, which lifted all their restrictions on June the 1st. And their cases are down, deaths have dropped, and any small outbreaks have been quickly under control. And I'd like to put our current situation in perspective. Months ago, I had laid out the metrics I wanted to see before reopening in addition to our vaccination rates. This had included new cases below 35 per day, and a positivity rate below 5% for a period of 2 weeks. Meeting these goals seemed impossible at that time. Well, today, our positivity rate is well under 5%. And our daily new cases are hovering right around that 35 number. So in Indianapolis, we have come far, but we still have an incredible amount of work to do. And for my part, myself and my team will continue to monitor our data. We'll improve access to this vaccine. We will analyze the experiences of cities around the world to determine our community's next steps. And so, what can you do to ensure Indy reopens soon? Get vaccinated. Get your friends and family vaccinated. Share your history of vaccination with someone who is unsure. Help protect yourself, your loved ones, and your community. And now, I'm going to walk us through our current data on Marion County. So when we look at percent of our positivity rate in Marion County through June the 12th, we see that our positivity rate is about 2.4%. And as you can see, we've been below 5% positivity rate since May the 24th. So definitely, we're already past our 2 weeks of being less than a 5% positivity rate. Next slide. When we look at our newly confirmed cases, and as you can see here, as of June the 18th, our number of cases were at 40 cases. But we also know currently today, we're now averaging since last Friday over a 7-day average that we're at 36 cases per day. And that's 1 week's data. Very hovering right at that 35 case metrics. Next slide. Our ED visits with COVID-19 symptoms have definitely declined. where we're only experiencing like 23 cases a day on the average through June the 20th. Next slide. We're seeing a significant drop in our hospital admissions for persons with COVID-19 positive cases. We're down to 6.7 cases per day of any hospital admissions for a patient with COVID-19. Next slide. And our death rates have dropped significantly since the second week in June. Next slide. And when we compare ourselves in terms of new cases per 100,000 residents in the Midwest urban areas, you will see we're continuing to decline in our new cases per 100,000 residents in the downward trend, along with the other Midwestern cities. Next slide. When we compare ourselves to our surrounding counties with new cases per 100,000 residents, you will see that May the 20th, we were at a high of 12 new cases per 100,000 residents, and we dropped down to a third of that, down to 4 new cases per 100,000 residents per 100,000, a significant drop. We also saw other counties drop like Hamilton, Hancock, Shelby, Morgan, and Johnson, with both Boone and Hendricks counties sort of plateaued right now. Next slide. In our age distribution, we continue to see that 43% of our cases are occurring in individuals who are 20 to 39 years of age. Let me say this again. 43%, almost half of our cases, are still occurring between individuals who are 20 through age 39. With the next largest group are 40 to 59-year-olds, and still continue to see a rise in our children less than the age of 20, but the predominant number of these cases are occurring in our 18 and higher age group of that less than 20-year-old group of children. Next slide. When we look at the cases broken down by race and ethnicity, we find that the largest number of cases are occurring in our Asian population, with 9,720 cases reported since last year, with the next group being our Latino X population at 9,280 cases, followed by our white residents at 7,591 cases, with the African American Blacks at the lowest number of cases at 6,904. Next slide. And where are we now through June the 18th in terms of being fully vaccinated? Well, we're at the 39% mark of being fully vaccinated. Our next slide. When we look at how we're faring in regard to the other counties, you will see that Marion County is now at that 39% fully vaccination rate. But Hamilton County and Hendricks County and Boone County and Hancock are at least past the 50% vaccination rate, and then followed by Morgan, Johnson, and Shelby, a little over the 40% rate. But let me just say this to you. We vaccinated in the month of May 125,000 individuals in Marion County. Let me say that again. We vaccinated 125,000 people in Marion County. And of that 125,000 folks we vaccinated, 75,000 were Marion County residents. So we're vaccinating a heck of a lot of people in Marion County per month, but a significant number of people continue to be vaccinated in Marion County that reside in other counties besides Marion County. Next slide. So when we look at it based on age group about who's vaccinated, you will see that for our age groups that are 60 and above, that we're seeing at least almost a 70% average of those being vaccinated. So we're doing a good job with the over the age of 60. But when you go all the way down to our 20-year-olds, anywhere from 20 to 39 years of age, you will see that we remain sort of in the 30 to 39% vaccination. So we have our work cut out for us related to that age group. And then just looking at our 20 to 24-year-olds, only 33% of them are vaccinated. And when we look at our 16 and 19-year-olds, mostly our high school group, we're at a 28% vaccination rate. For our 12 to 15-year-olds at 11.5%. But just remember, we just were eligible to even provide vaccinations for our 12 to 15-year-olds just a couple of weeks ago. But an enormous amount of work needs to be done with our younger age group. And even our 50 to 69-year-olds or 40 to 69-year-olds, we have plenty of room for more people to be vaccinated. Next slide. If we break it down by gender, sorry, Mayor, I just have to reemphasize this again. You can understand how the female is the superior species compared to our male counterparts. And so you see we have a higher rate of vaccination at 41% compared to 37%. I'm not knocking you, Mark, or anybody, but you do have to understand that. Ladies, you get the point what I'm talking about here. Next slide. If we break it down by race, we have enormous challenges related to the health disparities of who's getting their vaccine uptake. And on this slide, this identifies that the African American Black population or community here has the lowest vaccination rate at 23% compared to the white vaccination rate at 39%. So we're literally about half the African American population of vaccination compared to where we should be compared to our white residents here. And then you can see that our Asian population and our Latinx population are at 31% and 30% respectively at a much higher rate of vaccination. And so we all need to be at a higher rate, but broken down by race, all of us from a health equity standpoint should be at least at a 39% vaccination rate compared to our white counterparts or citizens here in our community. I believe that should be the last slide, I think.
That's right.
Thank you, Mayor. I appreciate you.
Thank you, Dr. Caine. As always, folks, we will now move to the question and answer portion. I believe we've worked out some of the audio issues that we were having at our last one. If you do run into anything, feel free to send me a text or email or enter your question into the chat But for now, I've got Tom Healy kicking us off. So Tom, you're up. Go ahead.
Thank you. Good morning, Dr. Caine. Question for you. A significant, at least something that was significant to me, is that the reduced percentage of cases for African Americans and Blacks. I wondered to what you attribute that, especially since that particular population has one of the lowest vaccination rates.
Well, I can say that I think a lot of education has taken place in the Black community. We've had so many webinars related to educating about the social distancing, wearing the mask, and doing the hand hygiene in terms of hand washing and everything. And I think that's been a critical piece for the African Americans. And let me just say, I just have to compliment our faith-based institutions, and that leadership has really stepped up to the plate. We've had organizations like the Minority Health Coalition of Marion County, Urban League, NAACP, just a whole host, sororities, fraternities. So a lot of education and community outreach has been going on.
Thank you, Dr. Caine, and thanks, Tom. Next question is from Eric Berman of WIBC. Eric?
Hello, can you hear me?
Yes.
Excellent. My question is about a couple of sporting events coming up. We've got Brickyard coming up, actually some IndyCar races as well. The Colts remain the only NFL team that has not lifted capacity limits. Is that going to need to wait for the vaccination targets to be met, or do you see any change at Lucas Oil Stadium or the Speedway before limits are lifted elsewhere?
So it will probably, those decisions related to those events will probably not take place until we have looked at our metrics around the July the 4th holiday. So
Hey,
I
Dr.
can't.
Caine, I'm going to add something too.
Okay, please, Paul.
Hey, Eric, thanks for the question. We're continually in conversations with the CIV, with the Colts, with the Pacers about how we can ensure that, when we feel comfortable, we can have safe sporting events across the city. Obviously, Indianapolis is a really, really big sports town. And like we did with the 500, we want to make sure that we have the safest, best practices in place. And hopefully here in the near future, we'll be able to talk more about that. So we appreciate the question. And that's kind of where we're leaning right now.
Thanks, Paul, and thanks, Eric. Our next question is from Leslie Bonilla of IBJ. Leslie?
Hi, thank you. Can you guys hear me? Okay, great. If I could ask two quick questions. So just to check, Indianapolis, the plan is still to reopen on or around July 4th?
Say that we are continuing to evaluate that and monitor our data.
Okay, so it's not for sure. Okay.
Not for sure, yes.
Okay. And then second question, in mentioning the Delta variant earlier during the press conference, what kind of concern is that for Indianapolis? Because seeing that like 60% of people aren't vaccinated, which would leave 30% like unprotected by your calculations. So I've mentioned this factor before, and there's something related to what we call a natural immunity related to someone actually getting a COVID-19 infection. And so that they develop a natural immunity a couple of months after their infection. So when you look at the level of protection in our community, it's much greater than just looking at our vaccination rate. And so that plays a major factor in our metrics as we try to look at our overall protection in our community. But notwithstanding that, the Delta variant has a predilection for 20 to 29-year-olds. And so we're very concerned and trying to get in front of this. And so we are grateful for institutions like IUPUI, who's making it a requirement for their 30,000 students and 10,000 faculty to be fully
vaccinated by fall. Butler University, I have to commend them, just announced this week that they're also requiring their students to be fully vaccinated. So I think that when we're having that vaccination rate, IU Health as a healthcare system, community health network, also making requirements for everybody to be vaccinated, I think we will start to see a significant bump in our number of cases being vaccinated, trying to get ahead of this Delta variant.
Thank you, Dr. Caine, and thank you, Leslie. Our next question is from Abdul from Indy Politics. Abdul.
Good morning. Can you all hear me just fine?
Yes.
Dr. Caine, a quick question on the vaccination process. I don't know if Marion County has done this. I know some other jurisdictions have made the vaccines available to doctors' offices as a way to get more people vaccinated because folks may trust their doctor or physician more than they do, say, a mobile clinic. So is that something that Marion County is looking at or has done already? And number two, how did our vaccination rates apply after the Indy 500 when we had 135,000 people out in the Speedway stands?
So let me take the first question. So we're definitely looking at trying to get the vaccines in our private practice groups, especially our larger groups and people that have already had a affiliation providing vaccines for children. So all of those who are already been in place providing vaccines from the National Vaccination Program, really trying to encourage them to provide vaccines to the community. So that's a plus, and that has been, we think, very beneficial to helping to, that will help to increase our vaccination rates. And then let me understand the second question you asked about Indy 500. Sorry.
Yes, Indy 500. How did things look afterwards? Because obviously you had a big event.
Okay. So, right. So we were able to identify that we are aware of about 19 individuals who tested positive for COVID and reported going to the race. And as you can also see that despite the Indy 500, we have not seen a surge or significant increase of cases as a result of the Indy 500. And I think that it was one of the critical factors was our percent capacity in terms of what we allowed in terms of distancing between the residents from the different households. I just have to remind you that Indy 500 had 135,000 individuals in attendance, which presented a capacity at about 40%. So we think that a number of the risk mitigation measures that we put in place, we're very pleased with our outcome.
Thanks, Dr. Caine, and thanks, Abdul. Our next question is from Mary Mills of WTHR. Mary.
Good morning. Two quick questions. Just to clarify, so you are holding firm on the 50% vaccination rate before lifting the remaining restrictions. That's question number one. And question number two is July 4th coming up and fireworks downtown, and obviously that draws huge
questions. So ultimately our decision to reopen is not about whether we surpass one particular metric. So that's no to your answer. In the sense, we sort of look at a comprehensive picture. And as I've tried to explain it a little bit in the past. So I look at what we call the prevalence, for example, of how much recent infection we have in a community that provides a natural immunity related to our community. If my prevalence is around about 38, I don't have to reach necessarily a 50% vaccination, but I'm looking at other things too. I'm looking at, wow, our hospitalizations are so low. 2, we're not having any deaths. 3, we're not seeing a lot of people coming into the emergency rooms for COVID-19. And so we're trying to look at what's happening across the country, other countries, what their experience has been, and what their numbers have looked like when they've reopened, in order for us to make a final decision related to that.
Thanks, Dr. Caine. And then in terms of the fireworks downtown.
So let me just say, you can get burnt with those fireworks. So, I don't think a lot of people are going to be sticking close together when they're popping out those fireworks. I'm hoping that's going to be the case. But let me just say, yes, we will be looking at that. But I don't know exactly what the number of people that will be downtown for the fireworks, what those numbers look like. But we'll definitely, obviously, try to monitor that. But remember now, we've had large groups that have been outdoors in the hundreds of thousands and have been able to safely not had any super spread event. So honestly, I'm less worried about that right now.
And Mary, I also know that downtown Indy has a number of alterations to the typical annual fireworks program, and I'd encourage you to reach out to them too to help mitigate some of those factors. Our next question is from Russ McQuaid of Fox 59. Russ.
And good morning, Dr. Caine. Well, to quote Meatloaf, 2 out of 3 ain't bad. So if we are seeing all kinds of progress on these metrics, is July 4th deadline an artificial goal, or why can't we open up now and give some relief to people instead of waiting 2 more weeks when at least the current trend shows right now you're at 39%, and maybe in 2 weeks you'll be at 43, which isn't going to be a whole lot of difference compared to the fact that you're making progress now on these other metrics.
So, wow. That's a good point, Russ. I just, I hate it when you ask me these kind of questions, okay? And I will argue it's less about the goalposts and it's more about determining our level of protection that will keep our community safe and prevent outbreaks. And as it has been throughout the pandemic, when new science and more data becomes available, and as we analyze it as it relates to our community, that's going to help do our decision making. And we're not quite there yet in terms of making that decision today. So if pressed, I can set a physical goal for our community, because we've seen a lot of our neighbors rise to the challenge when given the opportunity. But ultimately, making this decision to lift restrictions, it's more complicated than looking at one metric in a vacuum. So just not comfortable right today making that decision, Russ. But hopefully, definitely, we're going to revisit all the data and learn what we learned from other communities, and hopefully we'll have a positive decision the July the 4th weekend. But we still got 2 more weeks. We're, trying to knock it out of the park with our vaccinations and looking at our other metrics too. When we see our hospitalizations, our ER visits almost go off the charts.
Thank you, Russ, and thank you, Dr. Caine. Our next question is from Jill Sheridan of WFYI. Jill.
Hi, Dr. Caine. With the new pop-up clinics in place and efforts to reach people where they are for vaccinations, in your opinion, why were those moves made, and will that really make a difference to truly go to people where they are when we're hoping to increase vaccinations, and the incentive program as well? If you could talk a little bit about that.
So I honestly think it's critical for us to have moved to this process of going to people where they are, identifying venues that they're familiar with, and going into places where they trust the operations of their places. You know, when you've got concerns about a vaccine and you have a vaccine hesitancy, it can be difficult sometimes going to a location to get vaccinated that's not residing in your community and your social network. And so we think it's going to really have an impact. We also believe that $1 million mini grants that we've given out to the respective organizations, that they will be really instrumental in being trusted messengers, talking to people in their own social networks and reaching out to them in a way that we can't reach or we can't always access. So we have to always remember that there's a significant number of individuals out there that may have transportation issues, okay? May, because of their concerns of taking time off from their jobs. Will I have a job when I come back if I get sick and I'm off a couple of days? So it also requires us, while we're doing this process, we've got to talk to employers to say, hey, are you making it convenient for people to be vaccinated that you hire? So there's so many major issues that we're trying to address on a comprehensive standpoint, but we do think it will move the dime.
Thanks, Dr. Caine, and thanks, Jill. Our next question is from Russ Dodge of WITT. Russ.
Good morning, everybody. This kind of dovetails on what you were just talking about, Dr. Caine, about reaching into the community and the grassroots campaigns and all of that. But clearly, you see those numbers and you see there's still issues with younger adults not being vaccinated, African Americans not being vaccinated. On top of those grassroots campaigns, what are you doing in the mainstream media, you know, social media, electronic media, radio, television, and all that, that specifically targets those issues? Because you look at those numbers and you got to say there's still a good degree of vaccine hesitancy among those groups.
So you highlight a really important point, and it's about communications. And I'm happy to say that we've kicked off a digital social media campaign just this past week, and look forward to seeing some more targeted communications, social media, digital platform, reaching different racial and ethnic populations. That's going to be taking place probably in the next 2 to 3 weeks, to really try to dig down deep in terms of what will reach those different groups. What motivates a young American Black male who's 20 years old compared to, say, someone who may be 45 years of age or older? So different motivations based on the race, based on the age. And we've been doing a lot of research related to this in terms of what motivates. And hopefully you'll see a campaign that addresses those particular concerns about why people don't get vaccinated and what do they need to know in order to feel comfortable being vaccinated.
Thanks, Dr. Caine. We'll have time for just a few more, so I'll try to get through ones I still see here. Sherry Rudavsky of The Star, you're up next.
Thank you. Dr. Caine, I'm wondering if you can tell me what contact tracers are learning about where the 35 or so people who are testing positive for COVID each day, where is the disease currently spreading and how is it spreading amongst that small group of people?
So, Sherry, we do what we call contact tracing density spots. So we try to locate where those hot spots are based on the age. And we have some multiple sites that are located through Marion County. I can't specifically tell you that, but we do track our contact tracing locations that are popping up related to our most recent cases. And it can vary, contact tracing based on the age, and it can vary based on our contact tracing based on the race.
Thanks, Sherry. Thanks, Dr. Caine. Have time for just a couple more. James Briggs with the Star. James.
Yeah, just a point of clarification on the conversation about July 4th. My understanding is that for any change in the COVID-19 policies, the city county council would have to vote on that. I'm looking at the calendar right now. The next scheduled meeting is July 12th. And then the next one after that, if there were no changes, is August 9th. Is there an expectation that if a decision is made outside the confines of that schedule, that they might hold a special meeting, or how might that work?
That's a Paul.
Hey, Dr. Caine, I'll take that. James, thanks for the question. You know, we're in constant contact with the City County Council, both here at Health and Hospital, as well in collaboration with the mayor, and our legal teams are reviewing, you know, what the new requirements are from Senate Bill 5. And we can get back to you with more specifics, though I think some of the interpretations we've seen is that if there were changes that make us in line with the rest of the state, we don't necessarily need to go to the council for that, but we're still working with our legal shops to make sure we follow the process correctly.
Thanks, Paul. And I think last up, we've got Amelia Pack-Harvey with the Star.
Yes, Dr. Caine, I'm wondering, of the 19 individuals who tested positive from the 500, this is a twofold question. One, did we do any, have we been keeping track of the folks from out of town that might have subsequently contracted something while they were in town during the 500? And did we also, I think for March Madness, a while back, you mentioned less than 1% of the cases. Do you have a case count from that? And did we also do the same thing? I'm just wondering if we tracked or kept track of out-of-state folks.
All right, so of the 19 individuals who tested positive for COVID-19, they are all in-state residents. They're not from out of town. But none are Marion County.
And then I think, was there another part, Amelia, or is that it?
Yes, I'm just wondering, are we tracking at all or working with other health departments regarding the folks that come from out of state?
Yes, well, we didn't have any that came out of state. They were all Indiana residents, but none of them were Marion County residents. So they came from other counties in the state of Indiana. And so, yes, we work with other county health departments, and we also, in some cases, may work with the Indiana Department of Health as well. But we have a good cordial relationship when we interact with all of our counties when it comes to contact tracing.
Nice. Thank you, Amelia. Thank you, Dr. Caine. Thank you, everybody, for tuning in. We'll see you at our next update. We will send out the slides following today's update, and feel free to follow up with myself or the health department if you have any more questions. Thanks all.